Okay, guys, this is the part two of the evaluation documentation lecture. So we're going to discuss real quick about the level of assistance. So this is just like paraphrasing the definition of the level of assistance, and you need this in order for you to document how much assistance the patient needs in different tasks that we're going to talk about later. So when you say dependent, the patient did not do anything. So for example, from supine to sitting position, technically you lifted the patient up. The patient did not exert any effort to help at all. You call that dependent. Maximal assist, the patient only did 25% of the task and you did most of the task. For example, the patient initiated the push, uh, but unable to really sit up without maximally assisting the patient. So it's maximal assist. When you say moderate assist, 50% of the task was done by the patient. Minimal assist, patient performed most of the task and you perform 25% of the task. Contact guard assist is also called like incidental touching. So you're touching the patient to guard, for example, in standing position. You're touching the patient because of unsteadiness. So you call that contact guard assist. If you're just standing near the patient, just in case the patient lose the balance, but you're not touching the patient, that is standby assist. So if the patient, for example, is walking, within the room and you're not near the patient, you are supervising from a distance. So that is what we call supervision. So you're not standing near the patient and you are not touching the patient. So that is supervision. So this is when you're confident enough to let go of the patient and have the patient walk on his own around the room, you can call that supervision. And modified independent means the patient can do it by himself. He just needs more time to complete the task, or the patient needs, excuse me, an assistive device to do the task. Like, for example, the patient can walk with a front wheel walker by himself. So that's modified independent if the patient is using a walker. Independent, the patient doesn't need any assistive device and doesn't need extra time to complete the task. So that is independent. Just like, younger adult or, middle-aged adult who can perform any task with it without any assistive device. And there are some other older people who are active, and very engaged in physical activity that actually don't need extra time or assistive device to complete a task, and you can document that as independent. Okay, so next thing is current level of function. For the current level of function, bed mobility, supine to sit, you have to document that how much assistance the patient is needing, the sit to stand, the surface to surface transfer, for example, wheelchair to bed or toilet. Did you do a squat pivot transfer? Is it a stand pivot transfer, or the patient needing a sliding board? Or was the patient dependent with a Hoyer lift or a sit to stand lift? Gait, did you use assistive device? What kind of assistive device did you use? Was it a walker, a cane, a quad cane, a hemi walker? How much assistance did the patient need? How far did the patient walk? And the gait deviations, usually is there a heel strike or no heel strike? How was the push off or the foot clearance of the patient? Was it a wide base, narrow base? Was it an antalgic gait, or any kind of gait deviation that you observe? You have to document it, and of course, you have to document the range of motion, the muscle strength of the patient, the sitting balance, standing balance of the patient as well. Okay. In my inpatient rehab, these are the functional level that I need to assess during evaluation. And this is related to their quality index scoring. So the bed mobility, the transfer, the wheelchair propulsion, 50 feet, 150 feet, picking up the object from the floor, gait, yeah, 50 feet with 2 turns, 150 feet, gate on compliant or uneven surface for 10 feet, steps 1, 4, and 12, and getting in and out of the car. So for some reason that it is unsafe for the patient to do any of these tasks, you can document. So, for example, 12 steps not performed due to safety concerns. So this is in general what is required in the EPIC documentation for the inpatient. So there is a plethora of standardized tests out there. There is like a specific standardized test that will be suitable for each patient. You just have to figure out what will be best for the patient. But these are some of the many of the tests for balance, such as the Berg balance test, timed up and go, 30-second sit to stand or chair stand test, 5 times sit to stand test, gait speed. For endurance, you can do a 2-minute step test, the 2-minute walk test, and the 6-minute walk test. So I would greatly suggest you guys, there's YouTube there that you can actually search for each one of these tests and watch how they are performed, so you have an idea how to perform the test. So for standardized tests, ideally you should have at least one and two two standardized tests for your patient when you document. It's a big thing right now for documentation. So, and also this will help to monitor the progress of the patient with therapy. So I would like to thank you guys for watching. These are the books that I have written so far. So the practical tips for therapists prior to migrating or starting US practice, that's the first book. That's for foreign trained therapists. And I discussed that also partly in one of my YouTube videos. And then the PT Path to US. This is the step-by-step guide to United States application to become a physical therapist here in the US. So that is, those books are available at Amazon, both physical book and the ebook if you prefer to do that as well. So thank you for watching, and see you next time for my next videos, guys. Don't forget to subscribe and like this video, and if there's another video or lecture that you want me to discuss, just leave a comment. And I thank you guys for watching. Have a great day.